Welcome to Prescribing Lifestyle, the podcast that's all about empowering you to live your healthiest, happiest life. I'm your host, Dr. Avi Charlton, and each week we'll dive into the latest research, practical tips, and inspiring stories to help you optimize your well-being. From nutrition and fitness to mental health and mindfulness, we'll explore every aspect of lifestyle medicine, giving you the tools you need to make informed decisions and take control of your health. Whether you're looking into preventing disease, managing chronic conditions, or simply elevate your quality of life, Prescribing Lifestyle is here to guide you on your journey to wellness. So, sit back, relax, and get ready to embark on this transformative adventure towards a healthier, happier you. Let's dive in. Hello everybody, welcome to another episode of Prescribing Lifestyle. Today I have Dr. Sarah Hancock, who is from New Zealand. She is a PhD researcher. She investigated about dental caries disease burden in New Zealand children and how it affects oral health and general health. Welcome, Sarah.
Thank you very much, Abby, and thank you very much for inviting me on the podcast.
Thank you for coming onto the podcast. I would love to share your knowledge with my listeners.
Thank you.
Thank you. Tell us a bit about your journey and how you get into research.
Yeah, well, I had a bachelor's degree in physical education and then followed that up with a master's in health technology assessment because I got into the whole, quality of research and appraising systematic reviews across a range of areas. And then as time went on, I had a few questions about things that obviously mattered to me. I grew up with one of my younger sisters has type 1 diabetes, and so sort of grew up with sort of around that. And then some years later, when I had my own children, my younger daughter was diagnosed with non-celiac gluten sensitivity, and so we sort of went down this sort of pathway as a family again. But obviously this was much easier than type 1 diabetes to manage. But there was still that sort of awareness around diet. And so there are a number of products on the market, but they were all really highly sugary and pretty awful. And sort of became increasingly aware of, obviously was sort of through that previous 25 years to when I started my PhD in 2016, I was aware of the importance of higher protein diets, dropping processed or just decreasing the intake of processed carbs. But probably the protein element was quite important. And I remember reading that or getting more into that around about the time I had my first child and read, a couple of fairly old but really useful books, the way you go and get all these books on what to do with your baby. And one of the recommendations was to have protein at lunchtime and a good amount of it because, it did help, later in the day. Yeah. And so that seemed quite important and was also, and then, around about the 2013 year, I was training for a half Ironmans and other endurance events.
Oh, wow.
And found that actually the maintaining a good protein intake felt way better at the end of the day and recovered much better over that following 24 hours for when I was doing some heavier exercise bouts. And then sort of the low carb movement was taking off in New Zealand a little bit more. I'd been aware of the Atkins movement in the early 2000s and tried that and, but so got into the low carb thing, started doing a PhD, so looking at the impact of diet in children because I was increasingly aware that dental caries was it's the most common reason for hospitalisation of children in New Zealand. At this point in time, we have about nearly 30 children under the age of 5 are receiving surgery under general anaesthetic for the removal of multiple teeth.
Wow.
Which is really terrible. Yeah. So, every 20 minutes on any given workday, another child in New Zealand gets teeth taken out.
Oh my God.
I know, it's really terrible. And so, it's a diet related disease, much like, all your other chronic diseases, whether it's diabetes, type 2 diabetes, neurological disorders, cancers that, and there's been increasing amounts of work done now in the mental health space. But I was interested in dental caries because, it's a disease of metabolic dysfunction that presents very, very early in the life course. The fact that we've got small children severely affected by this, it's an indicator that there's some metabolic problems occurring. But it's not like it's quietly sort of building up in the background, like saying non-alcoholic fatty liver disease might be in teenagers. Tooth decay is really painful.
And they're very small children, and they've been affected so quickly.
Yeah, and I think it leads to a pattern of eating characterized by high-frequency snacking. And I remember talking about this some years ago with a cousin of mine, who's Professor Bernadette Drummond, who was a professor of pediatric dentistry at the University of Otago, and she maintained that what happens is these children get very sore teeth and very sore mouth, but under the age of 2 or 3, they don't have the language skills to explain that their teeth are sore. But how that plays out is that they don't want to eat at dinner times, or that it's difficult for them to eat the food that they should be eating, and therefore people give them, parents all very well meaning, will give them softer food. And which is easier to digest, so the kids will eat that, but they're never full. And so what happens is this cycle of snacking on carbohydrate-based softer foods like crackers that do break down quite quickly in the mouth continues. And so there's a habit established, but then the whole family starts eating like that as well too, because these things are in the pantry. It was interesting when I was interviewing parents during the course of my PhD, just to see what they knew about nutrition and then the barriers that prevented them from eating well. A lot of them would say, well, I used to eat really well before I had children. And then we started snacking and that sort of thing. So, so that's sort of, so knowing that, sort of got to explore the links between, diet and dental caries as well as obesity. And we do know that a high and frequent intake of refined carb-based foods is associated with dental caries in the same way that it's associated with childhood obesity and also the development of chronic diet-related disease. But also, we know that it's not just the very high sugar foods, that it's your refined starches as well. Because the action that they have in the mouth is they enable sugars to be retained for a longer period of time, which drops that pH of the level in the mouth down to below 5.5, which is the critical point for enamel dissolution of the tooth or of teeth.
So most mums know that the sugar's no good, but most mums wouldn't know about carbohydrates being no good as well.
And it's interesting. I mean, I'm never going to suggest, because there isn't evidence for it, that say potatoes, for instance, like cooked potatoes or cooked starchier-based vegetables like kumara or sweet potato or parsnip are going to cause tooth decay. But what we do know is that the more refined and the more highly processed starches get, that process of gelatinization of the starches, to be made into flour and all sorts of other things that are component parts of ultra-processed foods, that has an effect on increasing the karyogenicity of the oral environment and making it more acidic. Which is really interesting. There's some research, and it's not brand new research. This was done in the 80s and 90s about all this. But there is some good news, since we're low-carb enthusiasts, that we know that full-fat dairy is protective in the mouth, and we know that vitamin D-rich foods, such as what we'd find in grass, meat, dairy, cheeses, eggs, are also protective in the mouth as well too, or associated with protection. So there's good news. Well.
So the dietary guidelines doesn't really tell us to not eat all the crackers and the biscuits and the ultra processed foods as well. Nobody tells the mums about these things.
There's little to absolutely no advice on how to eat or to how to have your children eat in such a way to avoid dental problems. But worse than that, I mean, in New Zealand, some of the advice actually contradicts a lot of the evidence out there. So we know that, full fat dairy is associated with benefit, but after the age of 2, children are recommended to have low fat dairy.
Oh, yeah.
And also to, have lean meats rather than fatty meats.
Yes.
Which just seems crazy, given the evidence around this. But not only that, they're recommended to increase the carbohydrate intake as they move from early childhood through to being school age.
Yeah,
but they're also told to increase in New Zealand, they're told to increase the frequency of eating occasions of these foods.
Yeah.
And where this was really weird was that even the New Zealand Dental Association website had links to, the healthy food promotion guidelines, which are endorsed by the government, which recommend snacking. Now, they've adjusted this, that they're not recommending jam sandwiches anymore, but they're still recommending crumpets and muffins and English muffins to be consumed by children up to 6 times per day.
Oh, wow.
Which is a lot of eating occasions. But we know that that's an eating behaviour that's linked to greater dental caries burdens.
Yeah, absolutely. Yeah. Well, my kids will get a brain food break in the morning, and then they have their lunch, and then they'll have an afternoon snack. And then sometimes somebody's birthday, they'll have a lollipop or an icy pole. It's almost always somebody's birthday every day. And then Christmas and Easter, they share their chocolate around.
It's hard. And in many ways, there's a number of school environments, and just the timing of the day actually does interfere with all your best intentions with regard to healthy eating, particularly if there's food provided at schools.
Yes.
Yeah. I think my general advice to parents is control what you can at home.
Yep.
Yeah. Aim for progress. Nobody's perfect, and your kids live in this environment where they'll go to sports events, and whether we like it or not, there's Player of the Day awards that are sponsored by, whatever food company. But I think, especially when your children are quite young in that under 10 stage, or before they actually start being able to earn their own money through things like paper delivery rounds. I've only been living in Australia for a short time, so I'm not quite sure whether, early adolescents do those sorts of jobs. But in New Zealand, my daughters, for instance, who are now 18 and 20, they had jobs delivering local newspapers. And, so, which was nice, but then they start earning their own money and therefore have, start to exercise their own discretion on how to spend it. So I did all this, did some research as part of my PhD in which ascertained, what children and their parents, but also health professionals know about healthy eating, given that health professionals do instigate healthy interventions like you do, Avi.
Yeah.
And we found that all these 3 very disparate groups knew quite a lot about healthy eating, and that's probably a function of the people who will enrol in this type of study. But their knowledge actually dovetailed quite well with recommendations and dietary guidelines. So, for instance, everyone knew that high sugar foods like lollies and sweets were not good for your dental or your general health. And they knew that vegetables and fruit, everyone thinks are really good for both your dental and oral health. But right down to the foods that there are caveats around the consumption of in the guidelines, well, there was a little bit more variation in what people thought of that. But most remarkably, most respondents right across the board, whether they were, health professionals, including GPs, a few dietitians, some nurses, a couple of dentists, didn't seem to realise that red meat was actually good for your teeth.
Oh, yep.
Yeah, and that there was a range of views on full-fat dairy, on dairy produce as well. Yeah, so what that means is that, it's not like people don't follow the guidelines or just don't know, because what they do know, we know that those that health promotion messaging is quite well understood at community level.
Yep.
But there's also a lot of barriers that stop people from eating as well as they want to. And that's, worth exploring, because we'd like to think we're getting past the stage where we just tell people to do something and expect them to trot off and do it. There's all sorts of other things happening in this life.
Yeah. I don't think I was ever taught that meat and dairy are protective for teeth. I don't remember being taught that.
That's interesting you mention that, because in many ways I've heard various medical professionals discuss how they weren't taught anything about nutrition at university or as part of medical training. But it seems like, the dental profession that sort of operates over here and medicine is here.
Yes.
And there's sort of, it's interesting how little comparatively doctors know about the mouth and oral health, and the fact that, it's the very top of the gastrointestinal system, and there's, digestion occurs in the mouth as well.
Yeah. Most of the time I just refer to the local dentist.
It's
and very hard to know everything.
And when I interviewed some general practitioners, there was one that said, well, the only time he'd ever see anybody for any dental related issue was if they were coming in for the prophylactic prescription of antibiotics prior to having surgery, before their teeth got taken out.
Yeah.
And, that just seems really crazy, because, to check a throat, a child will open up their mouth or anyone will open up their mouth and the doctor will have a look at their throat. But nobody checks out the teeth or is in any position to do that. And especially when, there's, there are some associations between definitely periodontal disease and, some of those other effects. In fact, periodontal disease occurs quite a lot in people with type 2 diabetes, because it's a systemic inflammatory disorder. But there's, and I didn't discover this till quite late in my PhD, that there's actually a systemic mechanism by which, systemic inflammation has an impact on the health of the tooth as well too, which is really interesting, because everyone's taught that it's just a within mouth response.
Yeah, so it's not just the sugar that's causing dental caries. No. It's the whole body that's inflamed that causes dental problems, as well as the whole body being systemically inflamed, causing all the other things like diabetes and chronic illnesses. So interesting.
And I think especially when, this plays out in young children, like many of the diseases of chronic onset do start occurring in adulthood. Due to although type 2 diabetes is increasing in prevalence in adolescents, which are particularly in New Zealand, which is just completely tragic, really. But there is a systemic element, and it's regulated by the hypothalamus parotid axis as well too, which is fascinating, because that's not something that people are typically taught in the dental profession. They're also taught about, acid in the mouth. But then I was having to deal with some questions of my own with regard to why citrus fruit, for instance, is implicated in enamel erosion, but you don't get that sort of inside-out decay that you get from a very high refined carb diet, and and that very frequent intake of carbs as well too. I mean, there's a outside-in response that contributes to enamel demineralization, but there's also this internal response by which a tooth gets malnourished, and that's really interesting.
Absolutely. So that was your research, and what direction has that led you to?
Let's go into the sort of exploring the health coaching element, because I think for a range of reasons, how we've been treating non-communicable disease over the past 90 to 100 years hasn't been wildly successful. And I think I had this discussion with Dr. Pembrokner the other day, or a couple of weeks ago in Melbourne,
Yeah.
and we were sort of talking about, is this because of, 100 or so years ago, we had all these developments in medicine by which we got on top of infectious disease because of the invention of penicillin, and it coincided with, some other advances like the introduction of public health strategies like clean water. But because you could go and see a doctor and get treated for something acute happening, and we've had other developments like C-sections being relatively safe these days, because of the invention of and the creation of antibiotics, there's been this whole, let's just go to a doctor, they're the expert, and they will fix this. But while that works really well for an acute problem, that's not been proven to really be successful. So I've been training at the moment to be a health coach, doing that through Holistic Performance Institute, which is run by Dr. Cliff Harvey in Auckland, and he's fantastic. He's done a PhD on ketogenic diets in healthy populations, and he's been working in the ketogenic diet and in the clinical therapeutic nutrition for about 25 years. And so he was one of the early forerunners of low carb and ketogenic movements, and he's got the PhD in it. So, and he's wonderful. You'd probably really like him. He's a fantastic human being.
I have listened to a few of his talks and podcasts. He's very interesting.
Oh, very interesting. Wealth of information on so much in the diet health space. And so the health coaching course through that has been absolutely wonderful. And so I think that's where I'd like to go into, more into, how we can help families with kids, because it's hard. Busy lifestyles, there's time factors, cost factors, all sorts of pressures and barriers that mean that when, if someone just sits in a cubicle, as well-meaning as we all are, just telling people and educating isn't enough in and of itself, but we've got to actually help people become empowered to address some of those barriers through what they can do themselves. Because I think, I was working with a community group once, and I tried to encourage people not to feel like they were dependent on a particular person or a particular coach, that actually they're achieving these successes because they've got control of their own satiety, for example. And so they're making these changes themselves. And so, which is actually really lovely to see, especially people who have been on the diet cycle for a long time. And so I think, there's that element that I'm really keen to explore more in research and practice. And insofar as actually, and I think this is why low carb and keto diets can work particularly well for a number of people, is because they can get control of that satiety and, achieve satiety at meals, and therefore not be hungry and that sort of thing. Although I have to say, and I'm just sort of emphasizing that what people do 85, 90% of the time and above is what's really important. Because there's quite a lot around the whole diet culture that's quite harmful in many ways. When people go on a diet and then they sort of think they've got to then go off it and eat what they regard as normal again, and you're sort of thinking, well, actually you were eating quite normally anyway. And helping people just achieve those shifts in their own perception.
I have to be very careful with talking to young girls about diet and worry about anorexia and eating disorders.
It's a concern. I mean, gosh, you look at, there's all sorts of disordered eating, isn't there? Binge eating on ultra processed foods. There's a researcher in the United Kingdom called Agnes Ayton, who's done some really good work on the ultra processed food, and, how just that sort of thing, or that those sorts of foods are implicated in binge eating disorder, which is an increasingly recognised eating disorder as well too. And it's difficult. I mean, this, what young girls get exposed to on social media, for instance, is, a whole lot of influences where the messaging can be quite harmful. And not based on any real science, but they look really good. And the food is all colourful and all the rest of it. But, there's some concerns with that. But I think if the overall message is you're aiming for health, and particularly with, REDS and other issues, and they've found this particularly in teenage athletes, energy deficiency. And so most athletes or kids that I'm talking to is just emphasising that actually protein is really important, and it's going to be more, it's important for all stages of their development through the life course, but especially as far as, being able to get pregnant and maintain a pregnancy to term is super important as well.
Yeah. Just to explain to our listeners, REDS is relative energy deficiency syndrome. Is that right? Yeah. And these young girls, they don't eat enough nutrients and they exercise too much. And they have a sign of not having regular periods.
Yeah, and I think, the menstrual period should be a litmus test of, how your actual health status is. And I do understand that can fluctuate quite a lot, when girls first start menstruating. But, but by late adolescence, you sort of expect there to be a pattern that, if the periods disappear for a certain amount of time, that should be an alarm bell that something's not quite right. But, But then, it's interesting how much exercise kids can do under their own steam. As well, but the energy intake has to be maintained, but it's got to be good food. It's like for all of us, really, the quality of the food is super important.
I see a lot of young girls have iron deficiency. Most of them just eat junk food and they don't eat enough protein and not much red meat because they like chicken and fish, and they just don't have enough energy to supply their growth and the hormones and periods and reproductive system.
That's interesting, and you do wonder how much that promotion of plant-based diets that was really started to become a thing with the publication of the Eat Lancet study, and the sort of, a lot of promotion around cutting red meat consumption. I'll tell you, Avi, what's happening in New Zealand is that the Ministry of Education produced a resource that was going to be rolled out to children aged 10 to 14, all about how to reduce their carbon emissions and, do what you can for climate change. And one of the recommendations in that was to eat less beef and dairy.
Wow. Wondering if that's infiltrated by some industry.
Yeah, but that's being rolled out at schools.
Oh, no.
Yeah.
That's disastrous.
It is disastrous. You sort of think, goodness me, there's so much nutrient deficiency in these groups. You don't need any sort of measure intervention like that will decrease that more. So, I think there's a lot of that messaging, and especially when, my research showed that some of the messaging from whether it's media, education, what they learn at school, what they learn in their own families. People absorb those messages, and they're quite well learned at community and individual, family and community levels. And so when you've got all this promotion of plant-based foods, even though many of them are ultra-processed, they'll eat those, but what happens is your meat and your vitamin and mineral-rich foods get displaced from the diet.
Yeah.
And that's hugely disconcerting and very concerning as far as, the overall health goes. And it's
absolutely
not an easy fix, but
no.
Though I do think possibly an appeal to values, and there's a scientist called Christopher Bryant who's done some work on this, and that they went into a school and they educated, or, they attempted to, discuss what these kids value about the environment. And then they pointed out that a lot of these ultra-processed foods are associated with the production of a certain level of waste as well too, as far as the packaging goes. And you still think, well, maybe that's another approach if we're going to have to start using climate change or environmental reasons for, minding your food consumption. I think we probably need to tip it the other way by actually emphasising how much rubbish gets produced.
That's it.
In the production of a packet of biscuits.
That's it. They're all produced in the factory with so much processing and waste products. It's just terrible.
And the plastics these things come in, you can actually show kids this. You get a bin of, I don't know, you just look at actually even a packet of biscuits I saw in the supermarket the other day. They've got those little wee trays inside the plastic tray inside a plastic packet. And, that stuff just takes up space in a bin, doesn't it? And you can't really recycle it.
No.
Yeah.
So your direction will be going into health coaching, and
into health coaching, hopefully some research in that a little bit more. I'm employed at the University of Adelaide at the moment as an analyst. So my husband and I decided to, leave New Zealand after our youngest child finished high school, and she's at university in New Zealand along with our older daughter. And so we thought, rather than experience empty nest syndrome at home, we'll all empty out. And
wow! When are you moving to Australia?
Yeah, so we're in Adelaide at the moment. So
I didn't know that.
Oh, right. Yeah, only an hour's flight from Melbourne. Yeah.
Oh, okay. I thought you were in New Zealand.
No, not at the moment. No, the sun's still shining out here, whereas in New Zealand they're all watching rugby tonight, I think. So.
Okay. It's freezing cold in Melbourne.
Is it? Yeah. We had quite a nice day here today. Yeah. The sun's out, so that's good.
Oh, good. Well, just to wrap up with some practical advice, what practical advice would you suggest to mums with kids and teenagers that you can share with them?
It's about 3 things mainly. Is one of the most important is to focus on progress and not perfection. There's somebody else working in the low carb field called Libby Jenkinson. That was her mantra. She set up the she's done a range of work in this and worked with a lot of families, and so that's a pretty good mantra. Insofar as what people should focus on, the progress, and that what you eat 85 to 90% of the time is good. But as far as maintaining your children's oral health goes, you'd want to reduce snacking or between meal snacking and on ultra processed foods, which is the stuff that comes in packets, which has more than the 5 ingredients that you don't recognize the names or the numbers of the ingredients, and just stick to, if your child is busy and active and needs to snack on things, well, possibly, meat, cheese if they tolerate it, some fruits, but not just stay away from the chips and the crisps and the lollies and chocolate, but also a lot of those savory foods that are very full of refined carbs, but not a lot of nutrients. So that would be one of the main things, and just make sure that there's enough protein at mealtime. So there's 3 things. We've got the progress, not perfection, cutting down on the ultra-processed snacks, and eating the real food, but with a good emphasis on protein, because the kids and teenagers need it.
Yeah, they need it for growth. They need it for
growth,
health.
but because the amount of growth and development is occurring at such a huge rate.
That's it. That's great advice for our listeners, Sarah.
Oh, that's good. Yeah. And then hopefully that'll have some, better knock-on effects for mental health and anthropometric measures as well too, and just aim for health first and foremost.
Yeah, there's so many other things with kids and teens, like acne, eczema, skin conditions. Mental health conditions are so big with the teens nowadays, especially with COVID that's just finished.
There's a range of things out there that I think have an effect on mental health of teenagers. It's multifactorial, and the social media element of a lot of kids' lives and the lack of sleep that a lot of them are getting. It sort of seems to go hand in hand, really. We've had teenagers ourselves, we've had to sort of, manage that. And of course, then the lack of sleep has an effect on your motivation to exercise, and there's more, inappropriate or junk food or whatever consumed when you don't sleep as well. There's a whole range of associations there which are multi-directional. So, if we can just establish or enable family or help enable families to, because, they're doing it themselves. We're not moving into their homes.
Yeah, we're empowering them.
Empower them or enable them to feel empowered to actually, okay, here's what we have in our house, here's what we don't. But it does get difficult. See, when I interviewed some kids in focus groups who were aged 10 to 12, they'd say, well, their parents don't allow certain things in the house, but then they'd see their parents selling junk food at school fundraisers.
Yeah.
And of course, and then one child actually mentioned that, it's not like cigarettes and alcohol are allowed into school for sale at school fundraisers. And so there's this perception that, this food that's not really good for you actually isn't as harmful as something like cigarettes and alcohol. Because, there's authority figures are involved in having that enter the school environment and sold at fundraisers, even if they're sugar-free schools. But, once a parent-teacher association organisation gets involved in the fundraising, well, then those school rules don't typically apply. And, so it's difficult.
So many factors that affects our children's health. Yeah. Well, thank you for coming on to the podcast. You are a wealth of information.
Oh, thanks, Avi, for having me. It's been really nice catching up with you.
Yeah, I can talk to you all day, but I don't know if a long
I can talk to you all day too.
Yeah, that was fantastic conversation. I'm hoping our listeners can learn a bit more from you and dive into all those things about oral health and the kids' health. That's fantastic.
Okay, thank you very much.
Yeah, thank you for coming on. Until next time, thanks for listening to Prescribing Lifestyle Podcast. Thank you for tuning in to another episode of Prescribing Lifestyle Podcast. Before we wrap up, I have an exciting news to share. I have a new ebook called Low Carb Made Easy. It's now available. This guide is perfect for anyone looking to dive into the low carb lifestyle. Inside, you'll find the basic theory behind low carb eating, a detailed food list, practical meal plan, and a variety of delicious recipes. It's designed to make a journey to better health easier, simpler, and enjoyable. For those who prefer a hard copy, head over to my website and register your interest using the link provided. My website is www.mlcclinic.com.au. Head to online store. Remember, the information shared in this podcast, it's for educational purposes only and not proper medical advice. Always consult your medical professional before making any changes to your lifestyle and diet, or you can come and see me in Melbourne Low Carb Clinic. If you enjoyed this episode, don't forget to subscribe, leave a review, and stay connected with us on social media. Your feedback will help us improve and reach more listeners. Lastly, if you found this episode helpful, please share it with your friends and family. Together, we can make a positive impact to our health and our communities. Thanks again for listening, and as always, stay healthy and happy. Until next time.